So my name is Gina Del Savio. I am a hand surgeon and I've been in the community now since 1996. My background is I trained in orthopedic surgery down at Westchester County Medical Center. And when I left Westchester County Medical Center, I went to Columbia Presbyterian, where I did a one-year fellowship in hand surgery and came up to the Hudson Valley into Cornwall area in 1996, and I've been in practice here ever since that time. About 5 years ago, I took on some added responsibilities, and I'm now also the Chief Medical Officer here at Montefiore St. Luke's Cornwall Hospital, in addition to being an active hand surgeon. So one of the things that I've learned over the years is that it's really hard to know what to do when you cut yourself, because in the heat of the moment, people make not necessarily good decisions. And sometimes decisions are made based on the fact that what you're doing at that particular minute. I'm in the middle of a barbecue that I'm hosting. I can't possibly leave right now. Or I'm traveling. I'll take care of it when I get home. Or I don't have any health insurance, so I'm not going to seek attention right now, and I'll wait till I have health insurance to address it. So what I wanted to run through tonight was really super duper common stuff, but so that you make the right decisions. And then talk about too, like some of the decisions to make, because 20 something years ago, when I started practicing, your decisions were really go to your doctor's office or the emergency department. And of course, now we can add urgent cares to that list of options. So again, we're going to talk a little bit about how do you triage yourself if indeed you do have an injury. So one of the first things you want to consider after you injure yourself, because this is what I'm going to consider when you come see me, is how did you hurt yourself, right? Is it an abrasion? You fell down and you took all the skin off the side of your thigh because you fell down your gravel driveway? Did you cut yourself with a sharp, straight edge, like you were trying to get the pit out of the avocado and it just, the knife went into the hand? I see that all the time. Curse avocados, right? That are frozen brownies. I don't know what it is about frozen brownies, but people like to stab themselves going through frozen brownies. Serrated edge, all right? So now you imagine a steak knife, which has little teeth in it. Well, you probably haven't thought about this before, but there's a reason it's a steak knife. It cuts through meat great, right? So a steak knife is different than a straight edge. A puncture wound, right? We're talking about needle injuries or things like that. A crushing injury. I dropped a rock on my finger. Well, somebody just did actually about 30 minutes ago. I had told them to take care of it. So you drop a rock on your finger. But then again, you can have combinations thereof, and then you have to consider how clean or dirty. Did you just take the knife out of the dishwasher, or were you cutting up the rotten dog food and poked your hand afterwards? And then, of course, there's always this special case, which I would like to bring up today, especially is called a high pressure injection injury. So those are the mechanisms that we think of. So when we talk about road rash or abrasions, this is what we're talking about, right? You slid, you're hiking, you take the skin off your leg, and it hurts like the dickens, and it probably looks pretty ugly. But if you really look closely at it, you took the skin off. In fact, you barely took the skin off, and you can tell from the bleeding here, you couldn't have gotten too deep, right? So it's ugly, it's raw, and it's hurt, but there's no deep punctures. And this is the sort of thing where you could probably manage this at home on your own, right? You go home, some soapy water, maybe a little peroxide, some of the over-the-counter skin cleansers, maybe some Neosporin to put on it, like a topical antibiotic, and you keep an eye on it, right? And if at any point in time it starts to look like it's infected, then you would want to seek medical attention pretty quickly. Anybody want to tell me what you think an infection would look like in something like this?
Oozing.
Yeah, you see oozing, and you might get oozing from this anyway, because you think about it, you lost a layer of skin, and when you lose a layer of skin, you tend to ooze. But you start to get some redness around the edges, right? The edges start to feel full and angry, so that, that was maybe some bacteria got underneath the edges, and you're actually developing something called a cellulitis. So those would be reasons, obviously, for you to then start to seek medical attention, even if it's 24, 48 hours later, and even if you did everything right. And then we talk about the other weapons of choice, right? As we talked about really sharp stuff, I'm a hand surgeon. I get to see machete injuries. Don't ask why. Machete injuries. Now, machete injuries are actually a hand surgeon's dream because they're very clean cuts. If someone comes to me with a machete, it's almost like someone took a surgical scalpel and went through things. And when people do that, it's very easy for me as a surgeon to fix things. That's very different than table saws or serrated knives. Why? Because serrated knives or table saws, what happens with those is, think about what happens when you put a piece of wood through a table saw. What ends up on the floor? Sawdust. Well, guess what? When a serrated knife goes through the human being, there's a destruction of tissue. It isn't that you cut the tissues, but the stuff on either side of the blade gets damaged as well. And that really changes your prognosis for your healing from the injury, and it changes what I can do for you as a surgeon if you do injure yourself with those sorts of things. Puncture wounds. You know, everybody thinks of a puncture wound and whatever it is you got in your head, there's lots of ways to puncture yourself, right? You can puncture yourself with a thorn off of a rose bush when you're pulling some weeds, and then inadvertently you grab the weed and there was some thorns in there, and you ow through your gardening glove, right? There's the, oh, I'm watering my cactus and I'm not paying attention, and a cactus, spur gets into underneath my skin. There is, I'm hanging picture frames and I step on the nail that's on the floor, or somehow if I'm using a power nail gun, somehow that nail goes into me. And then, of course, there's just that good old-fashioned needle. One of my worst injuries I ever saw, believe it or not, was someone was cleaning her floor, and she was doing this with the sponge. And I guess a needle had gotten under underneath the molding. And when she went like that, the needle went right up under her finger. And she thought nothing of it at the time. It's a damn needle, right? It's dirty, but it's a needle. We almost had to amputate her finger because that poor needle was basically anything that was at the tip of that needle went deep inside of her. And of course, it's through a teeny tiny hole. So you can't wash it out. You can't clean it. So whatever crap was on the end of that needle was literally injected, underneath, deep inside of her. So again, all these thorns, they have different germs that grow on them because they're different kinds of plants or bushes, or they are in certain different environments. Animal bites. Now we all love Fido, but sometimes Fido, we had a patient here the other day in the hospital over the weekend. Her poor little dog got in a fight with another bigger dog, and she put her hands between them to, break up the fight. And we all would say, well, that's the stupidest thing I ever heard. But it's your dog. It's instinctive. It's intuitive. You just throw your hands in there with them, and then you realize maybe that wasn't the best idea. But anyway, differences between animal bites. A spider bite is different than a cat bite, which is different to a dog bite. So a cat bite, if you look at those teeth, those cat teeth are very sharp. Look at the difference between that cat tooth and the dog teeth. Not that dog teeth can't be sharp and do some damage, but dog bites are much more of a crushing injury because they've got a lot of power between their jaws. Cats use their paws for power. So if you get a cat bite, it's really more like the needle going into you than it is a compression injury. And it can be very deceptive as to how much damage is being done or how much dirt is in a cat bite because it's teeny tiny puncture wounds. And then, of course, there's we've been talking about contamination at the tip of teeth or the tip of needles, but then, of course, there's always the contamination of stuff that's on stuff that's outside. So it could be grease or oil from your snowblower, right? You think, oh, all that ice must have sterilized that beautiful blade before I shoved my hand in it and lost 2 fingers. But the reality of it is there's a lot of crap inside of there, mechanical that can be very, very contaminated and embed itself into your tissues. And similar with a lawnmower, right? The last time the dog pooped in the backyard, the bird crap that's in the backyard, the place where you spilled the hamburger 2 weeks ago and is now covered with maggots, but you're running and then you cut yourself on the blade. So again, lots of ways that you can contaminate these wounds without even thinking about it much. And then, of course, there's what we call farm injuries. Now, the lawnmower injury is pretty close to a farm injury, but a farm injury even implies more, right? This is like anything that's in your garden, anything that's outside that can contain animal feces or eroded products. Those things can lead to really nasty types of injuries. And so that has to be taken into consideration when we talk about what we're going to do. And then, of course, I did say to you that I had one extra special category, and that is called high-pressure injection injuries. When you think of an injection, you think of getting your flu shot or your COVID immunization, which I know you all got your COVID shots. But anyway, you think about a needle. It's a hollow device, and there's stuff behind it, and you can get injected with something. Okay, fine. But what about if that injection is under high pressure? Now, a high pressure injury at a low pressure, high pressure injury, to use that oxymoron, that would be like you go to CAT scan and they put an IV in your arm and they shove the contrast in really fast because they want to get a great image of your brain or your liver. And the IV in your arm blows, right? The vein blows. And so all the stuff that was supposed to go into your vein and into your organs so that the radiologist could read things ends up in a big, huge, pocket underneath your skin. That's one type of injection injury, which is sterile, but mechanically it's a lot of stuff. On the other hand, a high pressure injection injury, well, let's say you use a pressure washer at your house. Or maybe you like to spray paint. Well, all this, or you like to clean things with a high pressured solvent. Those kinds of things are extraordinarily dangerous injuries, and they can look extraordinarily innocuous. You're testing the pressure because the paint's not coming out of the paint gun, and it suddenly releases. And you go, ow, right? Because it doesn't feel great. But what you don't realize is that you just shot paint up your finger, into your hand, and into your form. And you don't realize it at the time. Because, as with anything, the sharper and the faster it is, the less it hurts. But over the next 36 hours, you can lose your hand. So high pressure injection injuries, if you ever experience one, do not judge the book by the cover. If you are using something that's high pressure in your household and it penetrates your skin, please present to an emergency department for evaluation, okay? Really, really super important. All right. So there's the how you injure yourself, and then you combine that, as we just talked about, with how does it actually look? Is this just through the skin and, good God, it's not even bleeding, for God's sake, right? Is it deep enough that you can actually kid yourself into thinking maybe you see some tendons or even a bone, right? You see some white stuff in there that you shouldn't be able to see, right? Is there actually missing tissue when you get this injury? Do you say, crap, even if I went to get stitches, I don't even know what they would close because there's a chunk out of me. Is there a deformity, right? So not only did I cut my finger, but it's pointing in the wrong direction. Bleeding. Now, maybe it won't stop bleeding because you cut an artery, or maybe it doesn't stop bleeding because you're on Eliquis or Brilinta or Coumadin, but because you're on a blood thinner, or maybe because you take a lot of fat-soluble vitamins and you just can't clot yourself. So you want to pay attention to bleeding. You put pressure on it, it just won't stop bleeding. Very important, and I can't emphasize this enough. Can you move it? Okay? If you can't move it, ding, 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 ding. Why? I'm going to show you a picture in just a second, because you probably cut a tendon, or you at least could have cut a tendon. And that puts this cut into an entirely different category. All right. Same thing with, can you feel it? Is there any numbness? And now, almost always when you cut yourself, right around the cut itself, it may be a little numb. What I mean is you cut yourself and you're numb below it. Okay. You cut yourself here and you can't feel it down there. All right. So if there's an area of numbness that's not just in a circle around the cut, but it actually goes outside the cut area, that again means that you cut a nerve. All right. And again, you want to seek medical attention. All right. So those are the things you really want to pay attention to. And I just bought this picture and I know it's a foot because I couldn't find an equally great picture of a hand. But what you can see here is all they did was take the skin off. The blue stuff is your veins. The red stuff, the red linear stuff is your arteries. The red, streaky stuff looks like muscle. The white lines are bones and tendons, and the yellow are nerves. That's what's inside. That's the jungle that's just underneath your skin. And if you get lucky, when you cut, you'll just cut the superficial little stuff, and you'll just have a little area of numbness around where you cut. But if you go and you actually, even if it's a teeny tiny cut, but boy, oh boy, you were incredibly accurate with your accident, and you managed to cut a major nerve or a major artery or a major tendon, you're going to be able to gauge that by either you can't feel it or you can't move it. And those aren't going to be indications that you need to seek medical attention. All right. So I think we can all look at this and say, this is bad, right? We don't have any questions, right? Then we look at this and we say, well, this isn't so bad. Ding, 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 ding. What did I just say? Don't judge a book by the cover. So did you get this little hole in your finger because your cat bit it? Did you get this cut in your finger because you were power washing your backyard and some of the water went into your finger? Did you get this because you got a paper cut, right? You have to look at the cut in the context of what was the mechanism of the injury before you make a decision, all right? So when would you want to seek medical attention? So this is a cut right here. You can kind of tell the thumb is on the right. That's the top of the index finger, big knuckle. And you can kind of see a little white thing there. That's probably someone's tendon. Okay, so if that cut gaps open, looks deeper than the top layer of the skin, you need to seek medical attention for two reasons. One, let's make sure you didn't cut a tendon or a nerve. But two, this is now deep. So even if you did it with a knife you just took out of the dishwasher, it's not sterile, all right? So go somewhere where they can clean it out and they can close it up properly, because otherwise, even if you wash it out at home, how are you going to make sure that that tendon's not exposed to more germs and gets an ultimate infection? So again, This is the kind of thing where you would seek medical attention when it's open up enough that you can see deep structures. And this is another take-home lesson. If you remember nothing else from what I say tonight, do not use bacitracin or any other Vaseline-based ointment on deep wounds. Road rash, perfect. That's what it's for. That's what it's for. You take the skin off of something, that's what bacitracin is for. You go any deeper than that, all the bacitracin does is it acts as a sealant. What does the human body do? Our bodies are amazing. You cut yourself, your body will push out the crap, all right? It will push out any germs, anything it doesn't like, it will shove it out and it will ooze out. But if you seal it off with a layer of Vaseline, it can't do that. And you'll end up with an infection. So bacitracin can give you an infection if you use it on a deep wound, all right? So again, take home. No bacitracin on anything that's deeper than road rash, all right? Another thing to think about is a deep cut over a joint. Now this, of course, is gapping, just like the last one was as well. So I think, almost everybody would say you understand that you need to go to the emergency department for this. But I also want to bring to the other point here is that there's not just tendons and nerves and arteries, there's also bones and joints. Now, honestly, if you cut into your bone, okay, yeah, you definitely have to come to the emergency room for us to wash out. If you cut into your joint, we're in a whole different category now. Why? Because joints are closed spaces. And so when you cut yourself and you actually violate the joint capsule, meaning that the stuff that normally makes the joint a closed space, you penetrate that in some way, contaminants can now get into that closed space. And you know what can't get into that closed space? Antibiotics, because there's no blood vessels. All right. So if you have a deep cut up against your bone, well, when I give you intravenous antibiotics, it's all going to get delivered around the top of your bone and the arteries and the nerves and the tendons and the muscle. But if you actually get a cut into your joint, it's a closed off space, except where you violated it. And that means the pus can accumulate to give you something called a septic joint. So if you get a cut that's near or over a joint, one, you should probably seek immediate medical attention. But if you decide it's too small to do that, don't ignore the redness and pain if it develops over the next 24 hours, because what that implies is, as little as that cut might have been, you somehow or other managed to get into your joint and give yourself a septic joint. And that is a surgical emergency, okay? Because if pus develops inside your joint, that can lead to destruction of the beautiful cartilage lining inside of your joint, which can lead to septic arthritis, which can lead to regular old arthritis, which can lead to a very stiff finger that doesn't work very well, or even amputation if neglected long enough, or if you're immunocompromised. So again, cuts over joints, please, please, please. Even if you don't think it's particularly huge of a cut, and it might not even need stitches, but if you think it was deep enough to make it into the joint, you probably should come in and get some intravenous antibiotics. So overall, deep wounds, immediate medical attention, where they in wherever setting you go to, they can do a deep wound cleaning. They put some Novocaine in there, or lidocaine is what we use in the skin, Novocaine in the mouth, so lidocaine in there so that they can really clean it out thoroughly for you, give you a dose maybe of some intravenous antibiotics, and then give you a prescription for some oral antibiotics to follow. Put some loose stitches. People go, why don't they didn't make it very pretty? Yeah, well, there's a reason, okay? Because if we close your skin tightly after a contaminated wound like this, that's super deep, the problem is, again, just like the bacitracin, now we've sealed all the bad crap on the inside and your body can't push it out. So although we do want to suture things, we aren't going to make it a plastic surgery pristine closure. We're going to loosely reapproximate stuff so that the body can still push crap out if it needs to, but at the same time close the area so that your tendons and your joints aren't being further exposed to the stuff on the outside, all right? And again, no bacitracin or other ointments. This is a deep cut. Even if they've closed it, it's still a deep cut. And again, you need to see a surgeon within 72 hours of a deep cut. Why 72 hours? What's so magical? If you cut a tendon or you cut a nerve, most of the time, we can fix those things. But we have a very small window of opportunity. Nerves and tendons need to be fixed within 10 to 14 days after an injury, all right? So in all fairness, I gave you 72 hours to get to the doctor. Why? That's if you cut yourself on a Friday night, you can certainly wait till Monday. But here's the deal. Don't wait till the following Friday. You go, well, you said 10 to 14 days. That's only 7. Well, here's the problem. The surgeon then has to assess you. The surgeon has to set you up to go to surgery, and they have to have time in their schedule to do you. So just in all fairness, I have added patients on, I operate on Fridays, and I've had that patient walk in on Thursday at 4 o'clock in the afternoon, having cut themselves, 14 days earlier. And I say lots of bad words in my head about that patient, in my head, right? Because now they just messed me up, right? Because now, and by the way, I'm going to be doing them at 7 o'clock at night because I already had a full day of surgery. I have no choice. I have to do it the next day. Well, but it's my son's birthday. I'm sorry. If you'd come to me last Friday, we could have done it on Wednesday night. I wouldn't have screwed up your son's party. But guess what? Neither one of us has a choice. So again, if you have a deep enough cut that you need to have stitches, and you have any sensory or motor deficits, meaning that there's something that you can't feel or there's something you can't move, get your butt in to see the surgeon within 72 hours so they can assess you. And if you do need to have something that can be fixed, they can make the arrangements for you in a very controlled, get approval from your insurance company, make sure they're not messing up your anniversary dinner, okay, all that stuff. Making sure you're doing it at the place you want to. Well, I only operate in Middletown on Wednesdays. Well, I don't want to drive to Middletown. Well, tough noogies, that's where I am tomorrow, right? So to maintain your most flexibility, make sure you see a surgeon within 72 hours. All right. So this is a dog bite. And if you remember, I talked about the difference between cat bites and dog bites, right? So that little finger up on the top was probably a cat bite, and it has its own dangers because that's the injection of dirt deep inside your finger. Here in a dog bite, dogs crush and rip and tear things. And so you can actually lose flesh. Jimmy, just about a month ago, had a little 10-year-old boy that a pit bull went after. This is what his arms and his legs look like all over. Now, what did we have to do? Well, we took him to an operating room. Like if you only had this one cut right here, we might be able to numb you up and clean this out in the ED. But I really have to scrub this. Look at the dirt. All right. And think about how dirty a dog's mouth is. This isn't just like pump some liquid through it. This is like, we got to scrub this, right? So if we're going to scrub this, we got to give you a little bit of sedation and some Novocaine or something, right? So in a 10-year-old boy, we took him to the operating room, and basically nurses, doctors, we all took a limb and we did a scrub while that poor child slept, and then maybe 1 or 2 loose stitches so that no tendons were open, but leaving everything else open so it could drain. Of course, we didn't put bacitracin on it. We put some dry dressings on it, gave him 24 hours of intravenous antibiotics, and sent him home on some orals. So again, if you see something like this, I think this is intuitive, obviously, because there's flesh missing, but you may actually have to be taken to an operating room for this to be cleaned out. Not always, sometimes we can do it in there, but again, just be prepared for that. And that comes back to, if you have a devastating injury, don't eat or drink. Because if we do need to do something right away, then you have to have an empty tummy. And I do not know why this is the case, but if I swear to ever-loving God that every time someone cuts himself, it's immediately after a 3-course lunch. I do not know why. And then my anesthesiologist have to say to the patient, well, we could fix you right now, but then you might aspirate and die. So let's wait 6 hours. And then you're sitting in the ER for 6 hours waiting for your poor stomach to empty. So again, if indeed you do have some sort of injury where it's bad enough for you to think about going to the emergency department and you think you might actually need surgery, don't eat or drink. And by the way, that's true for appendicitis. That's true for, I think I had a stroke. That's true, I'm having chest pain. Don't eat or drink, because if we have to do something to you, having an empty stomach is always better. All right. Again, cat bites, we talked about these being contaminated puncture wounds. Again, come on to the ED, because what we have are little angiocasts, these little plastic tubes that we can make the hole just maybe a little bit bigger than the cat tooth, and we can really flush that out for you, give you a dose of intravenous antibiotics so we can attack the potential crap that went in there from the inside, put you on some oral antibiotics. No bacitracin. And then, of course, 72 hours. Why? Because despite our best efforts, because these are such deep puncture wounds, you really want to get someone to look at you, make sure you're not developing an infection within 72 hours. So nail injuries. I want to talk a little bit about nail injuries as well, because they are super duper common. And what most people don't realize is that the nail is actually a really complex structure. Now, because I'm not here, I can't point to the picture with you, but if you take a look at that injury, the first picture on the left, where it says, it has all the words nail plate, sterile matrix, what else does it say? Germinal matrix, dorsal roof. So the fingernail, what we think about as the fingernail, we call, and just to be different, we call it the nail plate, right? Now the nail plate is the thing that you can rip off and go, ow, right? Or you have to trim or cut. That's your nail plate. Your nail plate fits underneath that nail fold. Your cuticle, okay, is just the beginning of your nail fold. Most people's fingernails go back about 3 more millimeters, which is a pretty good sized distance when you think about the oversize of your fingernail. And it's actually in a little groove. And that groove is what actually grows your fingernail, all right? The stuff that's underneath your fingernail, i.e. you rip your fingernail off and you like scream and curse and say bad words and it bleeds like stink, that supports your fingernail, but that doesn't actually grow your fingernail. That makes your fingernail a little thicker, but it doesn't grow your fingernail. Your fingernail gets grown way back before you guys can see a fingernail, tucked back into that groove. So that's why sometimes if you get an injury and you say, well, it didn't impact my nail. Well, you didn't see it impacting your nail because it was just a little bit proximal to it, but it still damaged that nail fold. And that's why there's a problem. The other thing to pick up here is that there's lots of different little spaces. And I think we talked about from the cat bite and other stuff and joints, bacteria love dead spaces because if a little bacteria gets into a dead space, it can fester and grow and it's hard to wash out. And the next thing you know, you have a nasty, horrible infection, right? So we call infections different things and we tell the medical students to learn these. You certainly don't have to learn their names, but things called paronychias, which are infections under the paronychium, which you can see that picture, which has a paronychia. The eponychial infections, and then of course there's subungual, meaning underneath the nail infections. And so again, like that young lady I prefaced this about who shoved the needle underneath her fingernail, she had a subungual infection, right? Which actually went into her eponychium and into that nail fold. So somehow it actually got down to her bone and we had to wash out her bone, right? That's because she jammed it hard and it was a sharp a needle. So those are all the things that are going on there. So again, with nail injuries, if the nail is completely off, please, please, please make sure you come in to see us so we can wash that out thoroughly. Sometimes you'll even have torn that delicate tissue underneath your fingernail and we can sew that back together for you so that you have less of a deformity to your fingernail. Sometimes we don't do anything at all. But again, if it actually involves ripping your nail off, really important. And then one last category, again, I want you to look at that fingernail, that view on the top left, that little fold. Just imagine you slam your finger in the car door, okay? What happens is that the nail can actually pop up from inside that groove and then settle back down. So it's inside, here's your nail, right? Or here's the groove, right? And here's the fingernail. You go poof, because you slam it in the car door. And then when it comes back up, now it sits on top of your nail fold. That's an NG, all right? This is no good. That's also a trip to the emergency department because you need that nail to be sitting here. You don't want it sitting on top, all right? So if you look at your finger and you go, well, it's not bleeding very much and it certainly hurts like the dickens, but all I see is my finger, I see my fingernail. Boy, it's covering up some of the skin. Ooh, get in to see us, okay? 2 reasons. One is if you actually went this hard enough to pop your fingernail out for it to come back like this, oftentimes you actually have a broken bone under there as well, so we should probably take a look at it. But the other part of it is too, is that you want us to get your fingernail back into the groove, one, and you want us to do it pretty quickly to minimize your risk of an infection, minimize your risk of a deformity. Because if you let it heal with your fingernail resting here, this groove heals on top of itself, and you may not get a new nail back. Whereas if you just let us get it back in there, all right, like this, and that's how you heal, most of the time you'll heal with that with a normal nail when it's all done. So again, just nail injuries, if there's exposed tissue or there's deformities, do make sure you come in and let us take a look at it. And again, that should probably be done on the first 4 to 6 hours as well. And again, this is just, again, most commonly I get these calls from people like, oh, I have blood under my, listen, if you have blood under your fingernail, what does that mean? It means that you crushed it hard enough with the hammer to rupture or damage the tissue, that delicate tissue underneath your, and it bled. That's what it means. Now, in the old days, and I say this when I trained 30 years ago, we routinely took off people's fingernails if they had more than 50% of their fingernail was blood so we could sew that tissue together and then we put the nail back on again. But what studies have shown is that, guess what? Us doing that doesn't change their outcome. The nail plate itself will act as a beautiful, what we call biological dressing, and it will hold everything flat. So even if you smashed everything and you may have a deformity, it's not going to be changed by me doing that. So leave it alone. Just leave it alone. So if you get this injury, really the only real reason to have to come to the emergency department would be is it hurts so bad because of the pressure of the blood underneath your fingernail that you need us to drain the blood out. All right. And we can do that. We take a little hot needle and we puncture your fingernail, right? And then the blood can leak out. Now, mind you, we can usually only do that in the first 24 hours because after 24 hours, what happens to blood? It clots. So at that point, we could poke a hole in your fingernail, but it's not going anywhere. Okay. So again, if, within 4, 6, 8 hours of an injury, you're like, holy mother of God, it's throbbing. It's like a cartoon finger going, wah, wah, wah. Okay, come on over and we can call it fenestrating. We can fenestrate it. It's a fancy word. We poke a hole in it, right? We can poke a hole in it so the blood can get out and make you more comfortable, Okay. All right. So again, just in summary, when to seek medical care. All right. Heavy bleeding or bleeding that does not stop, either because the cut is so bad or because you're on blood thinners, right? Either one of those are good reasons to come into an emergency department. And that should be an emergency department, not a urgent care. A reason I say that is because if it's bleeding, you may need surgery, right? Because you cut some blood vessel that needs to be repaired. They can't take care of that in urgent care. Obvious missing tissue or an amputation. Again, that's probably going to require some level of significant cleansing or even surgery. So you're going to head off to an emergency room rather than an urgent care. Cut, a simple, straightforward cut, whether it's a serrated knife or it's a machete, it's a simple cut. Urgent cares are okay, right? Because even if you did cut a tendon, you go, oh crap, I can't move my finger, but it's not bleeding terribly. And it was a knife, I didn't crush it. Or you can go to an urgent care, they'll give you a dose of intravenous antibiotics, they'll put you on the oral antibiotics, they'll throw 1 stitch in it, and then they'll tell you, how soon do we have to see the hand surgeon? It's a quiz. 72 hours, right? So you want to make sure you see the hand surgeon within 72 hours after the visit to that urgent care, because nothing against urgent cares. It's not emergency room staff. In fact, it's often a bunch of PAs or internal medicine doctors who don't know anything about cuts. All right, you now know more than they do. Don't tell them I said that, okay? So bottom line is, if you go to an urgent care and they put some stitches in, that's perfectly fine for your emergency treatment. But you do need to be evaluated then by a hand surgeon within 72 hours to make sure that your treatment was rendered properly and that you don't need any further treatment, okay? Again, seeking immediate attention if you can't get it completely clean. All right. And again, depending on what level it is, if you don't think you need surgery, you can go to an urgent care and they can do a good job scrubbing it out. If it's at the tip of your finger, they can numb up your finger and go to town on you. If it's up higher, it might be hard for them to do that, and you might want to go to an emergency room. Obviously, seek immediate medical attention if there's an area of numbness or weakness. Again, you can get away with an urgent care for this stuff if it's not actively bleeding, as long as you follow rule number 1, which is follow up with the hand surgeon within 72 hours to make sure everything is okay. All right, again, unable to move or use the limb normally. Again, you want to seek medical attention immediately. And then let's say you decided not to seek medical attention for a variety of reasons. If you develop at the first signs of redness, drainage, pus, swelling, fevers, other signs of infections, don't waste your time going to an urgent care. Now you got to come to the emergency department, right? Because you're going to need some intravenous antibiotics. In fact, you're probably going to need to be admitted for a couple of days or at least 24 hours of intravenous antibiotics. So save yourself the trouble. Come on over to the emergency department for stuff like that. Immediate medical attention if there's an obvious deformity. We talked about that nail sitting on top of your skin, okay? Or you crushed your finger with the hammer, and not only do you have a nice old big cut, but your finger's also pointing in the wrong direction. Please come on over to an emergency department so that they can take care of that. And then, of course, even if it looks innocuous, meaning that it doesn't look so terrible, if you have severe pain, that's your body telling you something. That's where it goes back to that injection injury. Immediately seek attention. Do's and don'ts. Do's. Clean it, even a mild wound, I don't care. And it hurts a little bit, tough noogies. Get it first line of soap and water. Then if you've got some peroxide in the house, pour some peroxide over it, even for a mild wound. Then once you've calmed down and you've stopped saying the bad words and shaking it, okay, or holding it like this, assess yourself. How does it feel when I touch it? How does it feel around the area where I touch it? Can I actually move things? And when I say, can I actually move things? Not, can I do this? No, can I actually move things? Okay. And then, of course, if you decide to go to an emergency department, please do make sure that whatever instructions you get from them, you follow. I love the patients who show up 48 hours after they went to the emergency department who were given a prescription for oral antibiotics, but tell me, well, I didn't want to start that till after I saw you because I wasn't sure if that was right. Okay. If the emergency department tells you to do it for the except vasopressin. If they give you a medicine to take, please do take the antibiotic. Don't wait to come see me because it won't do you any good. Don't neglect a wound. Don't ignore numbness. Don't use ointments on deep wounds. And also don't immerse your hands in any substance, whether it's Epsom salts. Again, if it's a deep wound, all you're doing is introducing bacteria. Do seek medical attention if you have any concerns whatsoever. No matter what I say today, if you're uncomfortable with how your cut looks, go to the urgent care, go to the emergency department, all right? Immediately go to the ED for high pressure injection injuries, and urgent care or ED, those are your two options. Don't go to your primary care's office. They don't have the resources. When I see resources, a combination of knowledge, antibiotics, sutures, dressings, they don't have that stuff to take care of you. So pick one, urgent care or ED, based on, what are some of the things that you learned here today. And if you ever have any question about it, go right to the emergency department and save yourself having to jump around. And again, don't ignore signs of infection, and don't wait for the numbness or the stiffness to go away. It won't go away by itself. That's my other favorite story. Well, a month ago when I cut myself, I haven't been able to move myself since then, but I thought it would go away once the cut healed. No. And then it's too late for me to fix it. All right. I only have 10 to 14 days to fix stuff. So 72 hours, see the hand surgeon. So no vasopressin and 72 hours to the hand surgeon. Two big take homes. But again, please, you are not doctors, and I don't expect you to be doctors. This is always fun and entertaining to talk to give you some pointers. But please, if you have any questions or concerns, this is you, this is your body. Get in your car, get somebody else to take you, and seek immediate medical attention.
Thank you.